A protocol is a document prepared by reviewers that outlines conceptual and methodological aspects used to conduct a systematic review. It serves as a step-by-step plan for conducting the entire project. Developing a protocol is critical in a systematic review because it reduces reviewer bias by limiting the impact of their expectations during the screening process. It also offers guidance for managing a review project, including role allocation, mechanisms for resolving disagreements, and project scheduling. In this video, we will cover registration guidance and systematic review protocol guidelines based on NeurosR guidelines and PRISMA-P checklist. Registration has become the new standard practice in systematic reviews. When registered, your protocol is time-stamped, and you can keep it private until the publication of your manuscript. Registering your systematic review protocol offers many advantages. First, registering your protocol promotes transparency and reduces reviewer bias and questionable research practices that can undermine robust research synthesis. Second, registration can avoid unintended duplication of reviews. Finally, registration enhances the discoverability of your work because others can find your work not only through publication, but also through a protocol registration platform. You should register your protocol no later than conducting the final search and extracting the data. Initial searches, which may inform your final search strategy, can be conducted before registration. Registration makes sure that your protocol is date-stamped. Depending on your discipline, choose an appropriate platform to register your protocol. Some commonly used platforms are Prospective Register of Systematic Reviews, Prospero, Open Science Framework, OSF, Campbell Collaboration, Systematic Reviews for Animals and Food, Collaboration for Environmental Evidence, and Cochrane. Although both NeurosR guidelines and PRISMA-P checklist recommend many items to address every stage in a systematic review, I will cover developing research questions and defining inclusion and exclusion criteria. Formulating a research question is not easy in systematic reviews. The question should not be too broad or too narrow. Let's look at some examples. What are the health benefits of green tea? This is too broad. Which type of green tea matcha or scent reduces the rate of heart attack in an otherwise healthy population? This is too narrow. This is a just right research question example. What is the impact of green tea on pressure? PICO and PECO are the most common research question frameworks for systematic reviews. PICO can be used to answer the type of well-formulated research question about intervention effects. PECO is a variant of PICO which looks at exposure rather than intervention. PEO is a simplified version of PECO when we remove the element of comparator. A classic question pattern is what effect of intervention X on population Y in achieving Z outcomes? Let's look at this example of a research question and find out what elements are. Now, I have a research question for you. Take a moment to identify the P population, E exposure, and O outcome on your own. Pause the video if you need more time. Once you're ready, hit play, and I'll reveal the answers so you can see how you did. Great job! Let's look at another example. Again, feel free to pause the video if you need more time. Granted, not all disciplines fit perfectly into a framework. If this is the case, please try a partial framework which does fit. Nevertheless, it's important to recognize that there are other types of well-formulated research questions. I will let you pause the video and read through the definitions of other types of well-formulated research questions and their examples. As you see, these types of research questions can range from identifying common patterns or themes on a specific topic to evaluating the strength and generalizability of a correlational claim or assessment method. Clearly predefined inclusion and exclusion criteria, also called eligibility criteria, is a pre-specified, unambiguous basis that determines the scope of articles to be included in a systematic review. Inclusion and exclusion criteria can help you produce more accurate, objective, and meaningful results. If the inclusion and exclusion criteria are established and executed correctly, they can also reduce the risk of errors and bias. If your research is interventional, you should specify the study characteristics such as population, interventions, comparators, outcomes, study design, setting and time frame, and report characteristics such as years considered, language, publication status. If your research is non-interventional, you should consider the main effects of dependent variables and independent variables described in a standardized form, detailed description of participant groups of interest, study design, and data collection method. Let's look at an example of inclusion and exclusion criteria for this research question. Since this is interventional research, the inclusion criteria can use PICO framework to classify the study characteristics. Specifically, the population is adults aged 18 years and over. The intervention involves computer, mobile, and wearable technology. The comparison is usual care or alternative treatment conditions. The outcome aims to reduce sedentary behavior. Additionally, the exclusion criteria specify report characteristics that should be constrained, such as language and a hospital setting.